Welcome back. When it comes to fighting the COVID-19 pandemic, many different tools can be vital. Mayo Clinic has expanded contact tracing to one method of preventing the spread in Olmsted County and across the country. But as our Alex Tejada is explaining, it has some challenges. Alex, what are you finding?
Tom, when contact tracing first began at Mayo Clinic, Dr. Breer and her staff found themselves overwhelmed in less than a week trying to make calls. However, a new streamlined way of contact tracing has simplified the process.
Household exposures often pose the highest risk because with our household members, we are not wearing masks in our households, and we have prolonged, very close contact with spouses and children and others living in our households.
While the virus can easily spread in the house, it can also be easily contained.
Identify a place in the home where an ill individual could isolate themselves away from the family ahead of time so that they aren't figuring that out, and develop a plan so that you could figure out how food would be delivered to that person so that they don't have to come out into common spaces like the kitchen area if possible.
The problem with contact tracing comes when someone attends a mass gathering prior to developing symptoms.
When an individual who has COVID has been out to a bar or a mass gathering in the 48 hours prior to developing symptoms, contact tracing becomes almost impossible because they don't know the identity of the individuals that had been around them.
Contact tracing is also more effective when combined with testing that provides results as soon as possible.
There's definitely been an evolution with that. Early on, when every test had to be sent out to a national lab and it took 5 to 7 days to get results, we essentially had to assume that the results would be positive and quarantine individuals that were exposed.
According to Dr. Breer, the test, trace, isolate strategy has helped slow the spread of COVID. However, there is a concern with healthcare workers contracting the virus outside of the workplace.
Very low transmission within the workplace, and the transmission that is occurring when people aren't wearing their masks. So there might be a situation where two people are eating lunch together unmasked.
With a spike in cases across the Midwest, Breer and her staff say they worry about the holidays overwhelming the healthcare system. They advise small gatherings or Zoom calls to keep your loved ones safe over Thanksgiving, even as unfestive as that may sound. Reporting live in the studio, Alex Tejada, KTDC News.
Alex, thank you. Mayo